patient is on tube feeding and we need to give meds. Okay, so this would be taped up there. All right, so now we're ready for the skill. The things that you need a 60 ml syringe. It will not look like this, and this, don't confuse yourself and be grabbing all over this one and then go over there and grab all over it. That one's sterile, this one's not. Okay, this one's just sitting in a plastic container on the side of the bed. But it generally isn't the one with the ring on it, it's just the ones we have in the lab. It'll look like a really big 10 ml syringe, like your regular IV syringes, it'll just be 60 ml. It has to have a cap tip, so when you're looking for the package, it has to say cap tip. If it's not a cap tip, it'll have the little hub that you can screw onto an IV. It's not what you want, it won't fit into there. Okay. So you need this, you need a graduated cylinder. This is in clean utility, no charge to the patient. You're just going to put tap water in it. Why can you put tap water instead of sterile water?
Just to mix up
stomach. I'm drinking tap water, they can drink tap water. It's just a little bit different to get it in there. And then you also need your meds. Okay, so generally when you're in assessing your patient in the morning, if you're doing your assessment, whatever, and you notice, oh, this has yesterday's date on it, let me go get some more supplies. Should be one of the first things you do for the patient or whoever's shift, they change this. Sometimes this is changed every night at 5 o'clock, or it's done every day at 3 o'clock, or it's done every morning at 6 a.m. If it's your shift, you should be the one that gets new tubing, hangs a new bag, gets a new syringe, gets a new graduated cylinder. These shouldn't be sitting there for a week, that's gross. Okay, so you've got these two pieces of equipment, and then you want to crush your meds, okay? So we've got little Smarties here. What do you need to make sure of before you crush meds? Make sure they can be crushed. Okay, so what cannot be crushed? Enteric coated. Now, if it's an enteric coated aspirin, we might be able to get away with it, but they have non-enteric coated that we could use. Because what's that coating going to do? It's just going to come off and be this plastic piece that you're going to have to get rid of.
With the pharmacy to make sure that you can get maybe a crushed form.
Yeah, like can we substitute this for the 325 regular? What else? What about docusate sodium, stool softener? What's that look like?
Like a capsule?
Yeah, it's filled with red liquid. So if you crush that, if you're strong, you can make it crush, but it's just going to spray red goo everywhere, and you have to get rid of that capsule. They have docusate in liquid.
Extended release or anything.
Extended release is a big danger. Some of them are just inconvenient to you as you're crushing. Some of them are a danger to the patient. So if you've got an extended release OxyContin that they're getting all at once now, or a blood pressure pill, that's an issue. So you need to just know that before you do your meds. Okay? So we've got our little Smarties here. So we're going to crush, and all the crushers are different. At St. Mary's are the little screw ones, which break the big pills and stuff. But at least they're individual. Because look at that. If I just did a bad thing as a nurse because I didn't clean that off before I did that. So what if they're allergic to my residual from the nurse that just gave meds? You know, and they were crushing an antibiotic and my patient's allergic to that antibiotic. Now it's mixing in. So you always want to clean your equipment, which is why the hospitals are going to the individual ones because it's just dedicated to the patient. All right, so I crush. The thing about this flat, hard surface is it kind of just crushes them to the bottom. It doesn't get them all crushed. So if you can see, there's still some non-crushed pills in there. And these are just Smarties. They just dissolve in your mouth. So you just shake it up. If you lose some, you have to start all over. Oh man, if you drop one of these, you gotta do it all again. It's not just like dropping one pill on the floor where you can go get that one. You have to charge them for all of them again because you don't know what is gone.
You get charged for all those pills again.
Well, they don't because you write waste, but still, you want to be really careful with this cup. Make sure that it's nice and.
Is there any specific medications you want us to know for our return?
No, just like the ones we talked about. Yeah.
For our demo in level 1, we did we put a cup on top of it too, yeah. So it stayed in there. Can we do that?
Oh, sure. That would be the cleaning issue.
I think that's what it was.
Okay. I don't know if it helps with my crushing issue, but because then you got to make sure you scrape it off. Okay, so it's pretty good and it should dissolve. I usually use like warm water, or at least tepid water. Okay, so I'm gonna take this in the room. Actually, I'm gonna pour it in a med cup. Okay, so now I'm in my room. I already have my equipment. If you forget and you just start there and start crushing your meds, it's fine. Just say, okay, I'm gonna go take my meds in the room. Just remember, you can't leave the room with the meds to go get your equipment. So usually that's something that you do with all this setup. And then you go get your pills, usually a couple hours later. So now we've got everything. At this point, I'm gonna say, good morning, Mr. Smith, I'm back. I'm gonna give you your medications, name and date of birth. I'm gonna sanitize my hands before I touch him. I'm gonna assess, make sure everything's okay. This isn't leaking. Maybe I'll need to change that gauze. If it's a new one, it's leaking a little bit. Make sure he's not having any belly pain or anything's not distended. We had one patient one time, we got 7 or 8 syringes full of air out. And the nurses just thought, oh, well, it's just air. And so they didn't keep drawing out. If you're pulling, you should get resistance. You should get nothing. I mean, we're sucking a stomach, so it should just kind of sink in. But we were like, oh. And we would detach and we would get rid of it. And we did that like 7 or 8 times. And then we got residual. So I was like, wow, that's why his stomach hurt. So the residual piece of it is really important, okay? So we've got this, so we've assessed, we've sanitized your hands. Before you touch the Gtube, you want to put on gloves. Just because it's stomach contents, you just don't want that on your hands. It's like someone throwing up on you. You're not going to die, you can wash your hands. But it's more pleasant if you're covered. I also put a towel down. Okay, this towel might not be here, it might, but if not, it'll be around for you to grab. Okay, so at this point we're going to stop our tube feeding, and we're going to pinch, and we're going to take that off. Okay. Okay, and then, oh, I lost my cap. That's why this would be taped. Okay, and so then you can cap it. Okay, so at this point now I'm going to check a residual. So there's a cap on here. I would take the cap off, pinch.
Sorry, let me back up. I'm going to empty it first. Throw that away.
Okay.
Come back and grab these and throw them away.
So if you pull back, you get some residual. Now in this one, when you're done getting residual, it'll just suck air. But on the patient, like I said, it'll kind of tug. So you're going to measure that. And I only got 20. Not a big deal. Unless we just started this and this is going at 20 an hour. Then he hasn't digested in the last hour. So that's not really good. Generally, you shouldn't get any residual. It should just, it's liquid. It's like if I just drank liquid, it should just go right through. But some patients, if they're just laying there, they're on continuous feedings, their bowels aren't really moving that well, sometimes they get more. So if it's going at 60 an hour and I get 60, doctor may want you to stop it. You may want to stop it just with nursing judgment and wait a little while. Okay? So that's the purpose. And who gets this? Is this mine or theirs? That's his. Give it back. We just want to measure. But keep in mind, you're going to write that. You're going to document that. Okay? Don't give them the air. You might be in the sweat.
You don't want to touch.
You're a swimmer. You're shooting.
You can't touch anything else except for where
Aren't you?
If you touch here, you contaminate it.
Okay.
When you're pulling up.
So we did that. We're gonna get our air out. So now we're gonna flush. Okay? Because we just checked residuals. So there's feeding and stomach contents in here. So we don't want to put meds in there because the meds could be like, oh, cool. Let's make a little clump, and then block it up. So you always flush before you give meds. Doesn't have to be a lot. Maybe 30 mLs.
So you don't want to.
The reason for the
You don't
towel.
want to go like this. Number one, you just contaminate it. You don't want to go, oh, whoops, whoops, whoops.
And generally it goes in nice and easy. If it doesn't, go slower.
So now what
Oh.
happens if I'm nervous?
I forgot to show the last group something.
What happens if I'm
Put that
nervous?
right there.
I'm doing all this part.
Okay, so then we're good there.
Now what?
And it's going through that, like, the middle port. Is that the middle one that you're putting everything
Yeah.
through?
If the feeding's going, you could put it through the med port if it's big enough. Like on this one, it's not big enough. So it just depends what you have. Some people leave the feeding going and just give the meds concurrently. That's okay. It's just a lot of them have an on and off port that you can twist. So I like to discontinue the feeding.
So this is a piece.
Okay, so you are going to
You have this in your way or fall
mix
down your
this
hand.
with water,
So grab it, pull it back in.
stir it up.
So if I've done that and I drop that, now what? No? Now you're just gonna have to put them both.
I don't know if I told your group or not, just
Remember I've got gloves on.
don't contaminate that syringe
Now you have an
because you're
extra
touchy on
surface
this one,
that you
okay?
can contaminate.
Cause you can touch all over this one,
If it
but this
happens,
looks the same as that one, so when you get over there,
If
if you
don't wanna
touch
grab
here, you
it,
fail,
just-
right?
So
Cause
do
it's
it like
sterile
this.
over there.
However, once now that
So
you're
it depends where you are in the
getting
room, what part of this syringe you can touch.
with your second alcohol, instead of just doing.
So what part can you touch here?
Everything,
Okay.
it's just clean, yeah, but this isn't the normal syringe, this is the exact same syringe you're using over there.
Okay.
So I don't want you to be like, oh yeah, and pull it up and hold it right here and her go, I'll see you next Thursday.
Probably that's
And you're
the
like,
hardest
what?
to do for dexterity.
So, but I think over there you're like,
Because one of the other people
more
has
aware.
alcohol.
Okay, so even Smarties, it takes a little while to dissolve. I like to use warm
You leave it
water.
like that.
You just grab right down here and open it from
The disadvantage with Gtube meds is it's hard to get every last bit. Like there's residual in there, there's residual in here.
In reality,
Actually, this did pretty good. The more water you add, it's kind of helpful. So we got most of it.
Practice all of it. Because
Okay,
this.
but you just keep adding water
this can be very
to dissolve it
difficult,
more.
especially if you're short-handed or if
Okay.
you have small hands.
Your
or
air
not a lot of
out.
strength. If you forget,
And then you need to
you want
measure.
to do your check with your cylinder,
But I think it's
can you
oh,
break
25.
the seal with the cap on? Okay,
So you're just gonna mark. So I already flushed with 30, and now I'm gonna do 25.
I'm not really gonna put it down there, but let's say that I've done all that, and I've actually poured my solution in there, and I've gotten ready to.
So now what do we need to do?
Obviously, that didn't happen, you didn't even realize.
So you don't wanna just put the feeding tube back on, because the meds are just sitting there. So if that's going real slow, they're not gonna get them for the next hour. So now you want to,
Make sure you're. So you can hang on here with one hand and pull up here with the other one, if you really have to.
How much are you
Play
flushing
and
it with?
see which is easiest for you.
20, it's like 28, 30.
Use
So
your
you would just
thumb
write
as
that down
the
on
one that goes in.
paper in the room, so you can put that in INO.
Pull up here.
So it was 30,
The markers
25,
are on the
and
syringe, so
looks
you
like
know
30 again.
how much there is, but, so just kind of play and practice with all of that.
Oh, actually, I'll leave that connected. And then you're gonna pull this out.
There's
It's
facilities
already taped over
that
there.
have different trays, they have different methods. There's one tray that already has the still water and everything in it.
And then you can start your feeding.
But, not every place.
So really,
There's.
it's
some of the
meds,
skills will show you to use
residual, flush, meds, flush. That's the main part of the skill, okay? We talked about a lot of other stuff, so, one thing I wanted to show the other group, if you do bolus feedings, because that's better, it decreases the risk for aspiration. Generally, we'll take the plunger out,
All I want, that's great.
attach this, and just pour this in and let it go by gravity. Okay.
Is that what you do if you have liquid meds too?
But let's say you did it.
Sometimes you will have a whole cup of meds because the liquid is, 5 milliliters of this and 5 milliliters of this. So you'll come in with 60 mLs. So if it's a lot, you can just pour it in instead of pushing it in. But if you get the residual and it's coming out good and going in good, you can just push it, just go slower with larger amounts.
So how much saline should be added into like the meds? I have like
Water,
30,
it's
25,
just tap
30.
water.
Does it matter
Oh.
how much?
It
or-
just depends on your meds. Like that was just 2 Smarties and it needed 25. So,
Okay.
but if you're mixing it with liquid, you could already have a cup of liquid, so you don't need to add water at all
Okay.
because you've already got some liquid meds.
So for flushing though, you want 30?
30 is good.
Okay.
Yep. Because if you think about it, 30 will get it through, but you can
Right.
use 60. If fluid is not an issue, 40 to 60 is fine.
Okay.
But if they're on a fluid restriction where we're counting every milliliter, then you go smaller.
But you always double, make sure.
Any questions on this one?
Patient response.
So not too bad.
Some of this